In a world where wildfires have become more intense and unpredictable, impacting not only California but other regions around the globe, it's crucial to recognize that poor air quality poses not only physical but mental health challenges too. Today we're joined by a licensed clinical social worker and director of clinical operations at CCA Health California. Commonwealth Care Alliance, or CCA Health California, operates Medicare Advantage plans in San Joaquin and Santa Clara counties. They offer benefits and services designed for high-need populations. Kristen Slater is here to offer guidance on how we can safeguard our well-being during these trying times. Welcome, Kristen.
Thanks so much for having me, Desiree.
Happy to have you on, Kristen. So what health risks can poor air quality pose to individuals, especially in the context of wildfires, and what initial steps should they take to protect themselves?
Yes, during and after wildfires, unfortunately, many people can experience that conditions like asthma and even heart disease can get worse. One simple thing we can all do is check the air quality index, or the AQI. You can do this through several apps, or you can go to airnow.gov to get more information. But in general, we want to spend the most time outside when the air quality index is green, which means that it's under 50, and spend the most time outdoors when the air quality index is the least amount of time outdoors when the air quality index is orange, which means it's over 100 on the index. Some other things you can do also are using air filters in your home, keeping N95 masks on hand, and definitely avoid going outside if there's a public health warning advising against it.
And how does exposure to poor air quality affect mental health? I was really surprised to learn that. So what practical measures can individuals adopt to alleviate its impact on their well-being?
Yes, that's right. Many people don't know that mental health can take a toll when air quality is poor. Studies have conclusively shown that exposure to poor air quality for long periods of time is linked to psychiatric disorders, including depression. Unfortunately, this can be a double-edged sword because when we're breathing polluted air, there's a direct impact to mental health. But then when we stay indoors to avoid these pollutants, the risk for social isolation and loneliness increases, which can also have an impact on mental health. This can be especially prevalent for older adults, low-income residents, or individuals with disabilities, largely due to lack of mobility or transportation barriers.
Could you share the reasons behind CCA Health California's dedication to addressing air quality issues right now?
Yes. CCA Health California takes a community-focused approach to care delivery. And what that means is we really work to understand the social and environmental factors impacting the communities that we serve. So we really work to share practical advice and local resources around poor air quality, since this is such an issue in our communities with both our members and our providers. Our number one goal is to improve the quality of life and long-term health of the members that we serve. And this community approach is how we do this. We're so invested in this that we've launched our own program called the Buddy Line. For members that want to increase social connection, we'll link them to a trained volunteer to provide telephonic support to really increase their social connectivity.
And are there any resources or support options available for vulnerable residents?
Absolutely. For older adults and vulnerable populations, there's multiple resources in the community that you can access. The first thing I'd recommend is that you check with local community centers or senior centers that are providing indoor activities to support both exercise and social needs. One resource to look for this is the website for the California Care Planning Council website. And then secondly, if you're having transportation issues, findhelp.org is another resource that you can use. And third, if you're feeling lonely, I'd encourage you to talk to a trusted person or a doctor about how you're feeling, or access the Friendship Line. The Friendship Line is wonderful because it's a free crisis intervention hotline, as well as a warm line for non-emergency emotional support calls that you can access. And then lastly, make sure you're getting mental health support from your insurance, because you can't help others if you're not healthy yourself.
All helpful tips. Kristen, thank you so much for joining us this morning.
Thanks for having me.
You bet. And you can find out more by going to ccahealthca.org.